According to a nationwide survey of U.S. adults age 50 and up, 4 in 5 people can't accurately estimate how much they expect to pay for healthcare in retirement. It is vital to the retirement planning process that financial professionals and their clients get a better idea for the costs they can prepare for. I'm Tim O'Mara with the Nationwide Retirement Institute, which was founded to provide financial professionals with the tools and insights they need to help their clients navigate the most important topics in retirement. And this is Healthcare, Planning for Costs in Retirement.
Fewer and fewer companies are offering their retired employees company health care benefits in retirement. We already know that 10,000 baby boomers are turning 65 every day, and that is going to continue until 2030. This means that many retirees will no longer have company-paid health insurance, which in turn means they'll need assistance with Medicare and may have other gaps to consider.
In a recent Harris poll commissioned by Nationwide, older adults were asked how much that they think annual healthcare costs are in retirement. 44% weren't sure or couldn't estimate, but in total, 84% of people underestimated or didn't know. Now, it's possible many people don't think about those costs because they know they will have Medicare and may mistakenly think it will cover all their needs. Medicare recently celebrated its 50th year as America's nationally subsidized health insurance. After several presidential administrations tried and failed to install a national senior healthcare solution, Medicare was founded in 1965 to help meet the healthcare needs of citizens over the age of 65 who were not covered by healthcare insurance of any kind. For financial professionals and their clients, understanding how Medicare works, its options, and costs is a key component of a comprehensive plan for life and retirement. And it's an issue where clients are largely uninformed.
Medicare is awash with jargon and presents clients with an avalanche of time-sensitive information that requires decisive answers. The choices someone makes can have a huge impact on their retirement income and quality of life.
Surveys generally show that most people haven't discussed Medicare with a financial professional, and they probably should. Medicare is a critical component of health coverage in retirement. And as more and more insurance companies exit the market for senior health insurance, Medicare, alongside Social Security, is a nearly universal retirement issue. Join me for part 2 in this series as we break down the options and implications of Medicare and learn how to translate questions about Medicare into a broader conversation about managing income and expenses in retirement.